in Australia, most people have the opportunity to move more towards plant-based diets, which are good for us in terms of health, and they also have much lower environmental impacts as well.
G'day, and welcome to Wellbeing. I'm Jack Hodgins. Today, we are discussing climate change's effect on our diets and health. We are joined by Dr Graeme Horton, a lecturer and researcher from the University of Newcastle. As a member of the Management Committee of Doctors for the Environment, Dr Horton co-authored the Climate Change Health Check 2020 report, which he presented at the 61st United Nations Department of Public Information Conference. In this episode, Dr Horton highlights the strains climate change has and will put on our food security in Australia, and how this will affect our diets and health. Hello Graeme, and welcome to Wellbeing.
Thanks very much, Jack. It's great to be here.
The World Health Organization has called climate change the greatest threat to global health in the 21st century. This threat has the potential to affect all aspects of life. One of the most important of these aspects is the food we eat. On the Global Food Security Index, out of 113 countries, Australia is number 31 on the spectrum of food security. For now, the nation is arguably quite stable in terms of access and sustainability of our food. But what could climate change mean to the future of what we eat?
Yeah, look, it's a great question, Jack. And you've highlighted there, very powerfully the point made that climate change is a threat to health. It's also an opportunity. And I think, as we think about food, there are many changes that are on the horizon for us. And at the same time, there's a lot of direction and hope that we can move and make those changes that will safeguard the future of this and future generations as well. But in answer to your question about, like, in Australia clearly, has a very, very diverse food production range of everything from livestock to grains. And what we're seeing in Australia and what we know the predictions are is for a long-term drying, particularly in the southernmost parts of Australia. And at the same time in the northern parts of Australia, we're going to get more extreme weather events, more periods of intense rainfall, and that can have costs as well in terms of periods of flooding and natural disasters in that regard. So, look, it really is a concern for a lot of the people that have their livelihoods in that area and who are concerned about the long-term viability of their crops. So, and thankfully we have a lot of expertise in this country as well in terms of how people can adapt. But at the same time, there are lessons for all of us who consume food to make sort of changes that are more in line with those long-term principles of environmental sustainability.
And you highlighted just then that thinking about the change, that it's an opportunity. Should we be thinking about that change as opportunity, that we have an opportunity to go some other direction?
Look, absolutely. You mentioned there about my role in the School of Medicine, and in fact, it's one of the best roles, the fact that we can talk about a complete shift towards an emphasis of global healing. Certainly we face threats, but this represents an opportunity for all of us to get on board with lifestyles and ways of being that are in line with safeguarding the future, in line with bringing down carbon emissions, limiting that global temperature rise to one that will safeguard the future and limit those sort of health impacts. So, look, there are opportunities on, practically every front in terms of how we use energy, how we exercise, what our diets are, how our attitudes to waste. And what I'm talking about here is really, that's even beyond thinking about ecosystems more broadly, which are obviously really important to think about in terms of how we safeguard biodiversity as well. But front and center, this is a human health issue. And that's why, the School of Medicine and my colleagues are taking it very seriously.
And talking about food specifically, how does the food we eat impact on us physically and neurologically?
So, look, I mentioned there about some of the opportunities that we've got in Australia of moving towards diets that are more in line with environmental sustainability principles. And in Australia, most people have the opportunity to move more towards plant-based diets, which are good for us in terms of health, and they also have much lower environmental impacts as well. So a significant there are significant benefits in terms of reducing cancer rates and improving or lowering rates of heart disease as well, from moving away from diets that are too heavy in things like red meat and more towards plant-based diets which are protective in that regard.
And you highlighted there on meat. I mean, we consume in Australia, we consume about 110 kilograms of meat per person per year. But despite this, red meat especially is very insufficient as an energy source when measured up against the resources it takes to produce it. To feed an Australian their yearly quota of beef, which is approximately 20 kilograms annually, it takes 300 kilograms of grain and 300,000 litres of water. Furthermore, 15% of all greenhouse emissions are caused by the global meat industry. Theoretically, building on top of what you were just mentioning then, if we were to change our collective diets with combating climate change in mind, what would be the perfect diet that was both health and environmentally conscious?
And look, you framed that question very well, because thinking about a perfect diet, really, there is room to think about the individual here. And some people have different nutritional needs. And that's why it makes sense for health professionals to be involved in this when we're tailoring diets that meet the particular needs of each person. I mean, I would say that, clearly, everyone needs to have that right balance of carbohydrates, protein, fat in the diet. And it's becoming increasingly easy to manage that within a plant-based diet these days. I mean, just anecdotally, I remember having a bit of a go with veganism, 20 years ago, and I just got incredibly hungry. Whereas, there are just so many ways in which you can have, the required amounts of protein in the diet. For example, vegetarian, vegan sausages can have like 20% protein per weight, and that's as well as and then further mix of carbohydrates and fat, which are really quite sustaining. So really, the further you can go towards managing, that distribution within a plant-based diet, the better it is for the environment generally. I mean, there are some considerations in thinking about food miles, and it's always best also to be consuming local produce because, air-freighted fresh fruit and vegetables have an incredibly high carbon footprint as well. But, but apart from that, moving more towards a plant-based diet is good for yourself and good for the environment. Now, keeping in mind that there are some caveats to that in terms of if people are exclusively vegan, then and by that I mean no animal products at all, so no dairy, no eggs, that can result in vitamin B12 deficiency. And so people who are exclusively vegan need to guard against that by taking B12 supplements. And again, that is becoming easier these days because a lot of chemists now have sprays that you can use under the tongue, which are better absorbed than taking B12 orally in the stomach. So there are these B12 sprays that you can get. Some people have B12 by injections or whatnot, but acting early when you start to embark on a veganism diet, if that's your choice, then starting with that sort of supplementation of vitamins such as B12 and looking at making sure that your calcium levels are good as well. These are all things that everyone can do. Now, there are some people I mentioned that might have other conditions such as iron deficiency, and so if people are affected by those sort of conditions, it's important to liaise with a health professional and making sure that you're getting the required amounts of iron and other minerals that you need as well.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr Graeme Horton, where we are discussing the effects of climate change on our diets and health. And one of the latest agricultural innovations, which came out in late 2020, is cultured meat. It went on sale for the first time. Cultured meat being meat produced without the slaughtering of an animal, but instead in a lab using cell culture. If this was to go into wide use, it could be a massive win for the environment. As someone in the medical field, what is your opinion of this?
I think it's. I mean, innovation is so important. I mean, at the moment, meat consumption worldwide in developed countries is increasing. So clearly, we need a range of solutions, and we need to confront these problems facing the world in a number of different ways, using every bit of ingenuity we can have. So I think all of those things need to be looked at. Yep. And the effect of how much nutritional content these sort of substitutes have, and looking at the studies that measure their long-term effects. All of those is important. It's important that they go into the mix, as well as some of the other ways in which I know that there's also important work going on in Queensland about developing up a type of seaweed diet supplement for cows to drastically reduce the amount of methane that they produce. Because, the methane produced by cows and sheep in Australia make up about sort of 70% of the greenhouse gas emissions emitted from the agricultural sector generally. So if we can reduce that those methane emissions, that's very important, because methane is 28 more times more potent a greenhouse gas than carbon dioxide. So it's important that everyone sort of is aware of these sort of different things on the table as a way of hope as well, and to see that we've got these solutions that people can get on board with.
So it sounds like we need to address the issue that do you think we're eating too much meat?
Yeah, well, look, I think in Australia, as you say, you quoted those figures, and in other places it talks about the average Australian having 57 grams or so per meat per day. And so, most people in developed countries can look at reducing the amount of meat that is eaten, and look to increasing their intake of other things in place of that, such as vegetables, nuts, legumes, to making sure that those minerals and protein content remains up. And that's good in terms of reducing those carbon emissions, reducing the need for land clearing, both for grazing of stock as well as planting of crops, as you mentioned, for livestock to eat. So all of that become part of the reasons why people should consider moving in that direction.
And as a collective, in the Western world, how do you think, in your mind, are we going to achieve that? How are we going to convince people to maybe stop eating as much meat and maybe go towards more plant-based diets, as you said?
So, and that's, I think, where it needs to be viewed as an opportunity, and it's a choice that I think we can, as health professionals, it's important for that to be part of the discussion about ways in which people can stay healthy. There's a term called co-benefits that talk about things that are beneficial for someone's health as well as being good for the environment, and this sort of reaches across food and power usage and active transport, people being able to exercise in ways that have lower carbon emissions. So you've asked how are we going to sort of affect that sort of behavioural change. I think that's where also we need to listen to those lessons learned about what motivates people, what gets people on board with changing in ways that's good for them as well as good for helping others. And I think part of it is just highlighting the risks that business as usual poses to our future and that of generations that are coming. That's part of it. But also for people to know that, look, there is a better way, and showing that to reduce your carbon emissions is achievable. It's achievable on a personal level. It's achievable at a local level, and it's achievable at a government level in terms of setting policy. I think it means that the challenge there is for all of us, I guess, to change where we can in our personal lives, as well as asking our decision makers, our government leaders, to be also acting in the long-term interests of the health and well-being of us, particularly the most vulnerable people in our communities, because it's the most vulnerable who have the most to lose in terms of the impacts of climate change. But they're also often the least well equipped to be making some of these changes. So therefore, That's a reason why each of us who can make those changes, it's important that, people see that as an opportunity of stepping up and helping others.
In Australia, we have approximately 85,681 farm businesses, 99% of which are family-owned and operated. Statistically speaking, a lot of those working in this industry face struggles with mental health. Some factors that can cause this are lack of access to support services, poor profit margins, and environmental aspects. With climate change in mind, we know that our farmers are going to be the first to be negatively impacted before we see that impact hit our supermarkets. How is climate change going to affect the well-being and mental health of our farmers?
So, Jack, I guess it's a number of ways, and these are some of the most confronting of stories that we hear about climate change in terms of just year after year the different ways in which some farmers have been affected. In terms of that long-term drying that we spoke of earlier, that's projected for Australia in terms of longer term droughts. Other changes in terms of salinity and drying of river systems that make it harder or decrease the viability of some agricultural businesses. And then on top of that, you've got those periodic other natural disasters such as bushfires, which you mentioned that climate change health check report. I mean, one of the things that we looked at there was what the firefighters were telling us about increased risk of bushfires in the years ahead. So we know that bushfires are expected to be more common and to be more difficult to extinguish. So you've got those long-term threats, you've got those natural disasters. It's important, therefore, to put in place things to safeguard the mental health of people in those areas. There's been some important work done by Hannigan Butler looking at drought over a long-term period in New South Wales between 1970 and 2007. And they found that, according to their modelling, that, when you looked at deaths of men in rural areas between the ages of 30 and 49, that actually 9% of those total deaths in that group could be attributed to suicides with some association with drought. Now, that's before we've started to see a lot of the effects of drought that are projected. So safeguarding the mental health and improving mental health services in those areas is a real priority that I know a lot of my rural colleagues are working very hard on. I think we need to ensure that, we spoke about transitions away from some industries to others. It's important to make sure that farmers aren't the ones that suffer in that regard, and that there are, government incentives and supports to ensure that people can move in the direction of more long-term environmental sustainability for their crops. In making sure that our communities in those rural areas have the best in terms of preventative and also treatment facilities in terms of, doctors, hospitals, other health professionals, nurses, allied health, that rural areas remain good places to be.
And I guess building upon that too, our farmers are deeply important to our country because they feed us. We should definitely be looking into that. And I think the things that you highlighted on, like getting those supports in there, I think that's deeply important. Yeah,
look, absolutely, and look, it's really important that some of those solutions sort of start with in those communities, and that we take note of what those communities are asking, and that clearly that rural people have a very, very strong voice in shaping these sort of solutions. Some of the areas around transport as well, and water security, making sure that these towns have enough water, and that people aren't sort of taken to the brink. That the next time we have a drought, that we've got the infrastructure in place to make sure that people can maintain their futures in these areas in industries which are robust, considering the environmental changes that are before us.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr Graeme Horton, where we are discussing the effects of climate change on our diets and health. You co-authored the 2008 Climate Change Health Check 2020 report. How accurate did that report turn out to be when we got to 2020?
I'm not aware of any aspect of that report that has not played out, with the possible exception of maybe the heat waves, and may have been underplayed in terms of those projections in what we're seeing occurring now in Australia. But it was, in some ways, even within a couple of years of writing that report, we had, the terrible 2009 bushfires in southern Australia. But the report covered, issues of increased heat stress, heat waves, bushfires, changes in vector-borne diseases, and how the areas in which some diseases like dengue could expand with increasing temperatures, particularly in northern Australia, and then issues such as sea level rise. And the report called for strategies at every level to reduce carbon emissions. I guess that's what hasn't happened in terms of reduction. That's something that we just need to keep pushing for at every level to get those strategies in place. And the health system itself has a really active role there to play, which was also part of that Climate Change Health Check 2020 report, and there's been more information come out about that now. The fact that an important study by Malik at University of Sydney showing that the health sector the health sector contributes 7% of Australia's total greenhouse gas emissions, which is equivalent to the emissions from the whole of the state of Australia. So there's so much opportunity for the health system itself to take a lead, and the health system is made up of just lots and lots of motivated and innovative individuals who are coming up with solutions, left, right, and centre as well. But it's important that that's led from the top, from government as well. There's a lot of work to be done.
Yep.
But what's really encouraging is the extent to which our current students, the next generation doctors, are just completely on board with this. It seems in our program, really. We'll be handing over to them at some point to make sure that they have as much at their disposal to address these challenges.
Australia's Department of Health and Ageing has published work informing us that the 5 groups are vegetables, fruit, grain, meats and dairy-like products. With sustainability in agriculture at risk because of the changing climate, if one or more of those 5 food groups was to go, would there be drastic effects on the overall health of our society?
So, look, I think it will always be there will always be alternatives for those 5 groups that you mentioned there, of people getting the nutrition that they need. If we can keep our planet to a temperature that results in are still. It works as a life support mechanism. Basically, it needs to operate within a certain level. It's important to keep temperatures so that plants can still grow. That's obviously an important principle. The reasons to keep it, a tighter control. We know that, as carbon dioxide levels raise, that's, some plants actually can increase the rate that they grow, but it actually decreases the extent to which they incorporate nitrogen and protein. And so protein levels within plant-based foods can drop, which that's a concern for people who are most at risk of protein malnutrition. So that just highlights one of those complex interrelationships between the greenhouse effect and plant growth. But I think it's important to therefore have options in terms of where people can get protein from, and making sure that we've always got a source of protein from legumes and other plant-based sources. And where possible, I think it's also important for the the livestock industry to be and the fishery industry to moving in those directions of environmental sustainability as well, to make sure as smooth a transition as possible. So I think I think we should. There will always be solutions and alternatives, provided we can keep within those limits of where humans can survive in a safe climate with levels of biodiversity that we need.
And what have your observations been of the massive, like the big food companies? Like, have they been responsive to climate change? Well,
certainly looking around locally in Newcastle, it's easier. As I mentioned before, it's so much easier now to have great food choices in terms of plant-based diets. Some of the good sort of gourmet meat alternatives that are around. I think there's room for improvement in terms of signalling to people, the different food miles that are associated with each of the different sort of fruit and vegetables in our stores. So I think there's room for people to get more on board with highlighting to people the implications of the choices that they make in terms of diet, and I think that there needs to be more done in terms of incentivising people to be having or to be investing more in replanning, to be investing more in offsetting the emissions from their industries, and to encouraging people to buy local where possible.
So do you think that the way forward is possibly thinking about it more locally?
Look, where possible, and that means promoting links between local communities that can grow food and the people of those communities that can consume it. I mean, some of the great things that I've been involved in that I can't take any credit for at all, because some of them have been led by fantastic medical students from the Australian Medical Students Association, who've convened these multidisciplinary sort of workshops and think tanks where people come up with ideas. And some of those have, been ideas to ensure that, hospitals can have close links with local communities, local farmers, and to be, reflexive to, what's seasonal, and minimising food waste as well. That's another big part of it. So, I think we need to recognise transport as a resource not to waste as well, because of the implications for fossil fuel emissions there as well, and where it's possible to have communities self-sufficient.
We're almost out of time, Graeme, but are there any points you'd like to bring up that have not yet been addressed?
No, look, I think, it's great to cover all of these issues and to see how, much they all interrelate, but I think, I'd just like to leave that idea that this is the chance for all of us to be part of like a global healing sort of phenomenon, where, we can see some of the writing on the wall about what's going to happen if things don't change. And this is a chance for all of us to sort of just think about how much waste we produce, how much greenhouse gas emissions result from our lifestyles, and that there's a better way, and that there's so much to feel good about in that regard, in terms of thinking about, joining with others who are thinking about the same sort of things. There's a relational component to acting on this. It's important too that people don't get overwhelmed by the scale of it, and to recognise that all of us can't do everything. Yep. Like, sometimes a coping mechanism is to sort of focus on one particular element of this and say, well, that's my thing, and I'm afraid I just can't answer the 30 or 40 emails I'm getting about this every day, but I'm going to focus on this one particular area and feel good about that, and feel sort of, and also just to make sure that when faced with these sort of things that we can feel worried about, that we recognise those emotions, be kind to ourselves and to recognise them, and take time out when we need to, and then just to recognise that really reducing our own carbon emissions is a coping mechanism in itself, and it's something that we can feel good about.
Well, thank you, Graeme, for sharing your insight with us today on the effects of climate change in our food. We appreciate you taking the time.
Great to talk with you, Jack. Thank you.
My guest today was Graeme Horton, lecturer and researcher from the University of Newcastle. And if you like this content, check out the Wellbeing podcast for more. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.